Good evening friends, I am Dr. Anagha Heroor, Medical Director, Anil Eye Hospital. A very common question asked by my patients is which procedure to select for my eye, a blade procedure or a bladeless LASIK procedure to remove my glasses. So in this video, let's discuss which procedure you should select for your eye. To answer this question, let's first understand what is the basic difference between these two procedures. For this, we need to understand that there are 3 steps in LASIK surgery. The first step is the making of a corneal flap. The second step is laser that is put on the eye. And the third step is the corneal flap that is put back on the eye. Now the basic difference between a blade and a bladeless LASIK is in step number 1. That is how we make the corneal flap. Now in the blade procedure, a specialized calibrated microkeratome blade moves on the surface of the eye, creates a flap. Whereas in a bladeless procedure, we use a femtosecond laser, which is an extremely precise form of laser, to create a cleavage plane which makes the flap. Once the flap is made, in both the procedures, the flap is raised and the excimer laser for correction of the number is then applied. So the basic difference in the two procedures is in the making of the flap. Now, if you would ask me, what is the difference then between the flap of the blade versus the bladeless procedure? In the blade procedure, if you see the structure of the flap, it is thinner in the center and thicker in the periphery. That means it is not equal in all the sides. That is why sometimes this can have a higher incidence of flap related deformities. Whereas if you look at the bladeless procedure, the flap is equal in thickness in all the places, in the center as well as in the periphery. And that is why the incidence of flap related irregularities or deformities is very less. So this makes a bladeless procedure more accurate and more precise. So if I want 100 micron flap for you, and if I make it a computer calibrated procedure with the bladeless laser, then you will get an accurate 100 microns. Whereas with a blade procedure, because it is a manual one, there can be a little variability. So with the bladeless procedure, the accuracy and the precision is much higher. Now the next question is, are both equally safe for me? Now when we use a blade procedure, we make a flap, and when we put it back, the making of the flap can have certain issues or certain difficulties in certain specialized. For example, if the cornea is very flat, or if the cornea is very steep, or if the cylindrical number is higher. In all these patients, we definitely prefer a bladeless procedure where the laser performs the flap, and irrespective of the curvature of the cornea or the thickness of the cornea, we get a very safe flap. So in many cases, we prefer a bladeless procedure to increase safety, and that is why bladeless procedure is the procedure of choice in most patients. So when it comes to the final question of which is the best for my eye, friends, let me tell you, even if femto LASIK is slightly more expensive, what you get is more safety, more accuracy and more precision. And that is why definitely femto LASIK or a bladeless procedure is definitely a procedure of choice and one step ahead. Thank you.